Okay, good morning everyone. Welcome to this workshop, which is focused on presenting some resources that may be useful to you as public health practitioners. My name's Rahman. I'm the Head of Public Health Workforce Development and also the Scheme Coordinator for Wessex, and also work across the South East region. Deb?
Good morning, everyone. My name's Deb Lear. I'm Head of Public Health Workforce Development at Health Education England down in the Southwest, and also Scheme Coordinator for the Southwest.
Brilliant, thank you. We don't have a lot of time and there's lots of resources that we would like to talk to you about, but we've decided to focus on two very recent resources for today's session. I'll be talking about the Behaviour Change Development Framework, and Deb will be talking about the Public Health Practitioners Education and Training Directory. You're familiar with the chat. There will be time at the end of the workshop today for a few questions, so please do put your questions into the chat box as we go along. So I'm going to kick off with the Behaviour Change Development Framework, which is a Health Education England tool that we developed to support behaviour change development of the workforce. And I'm just going to come out of this presentation and take you to the website to give you a live demo. So the Behaviour Change Development Framework is essentially this. There are 4 levels of behaviour change interventions that the framework has identified, which is informed by the NICE guidance on individual level behaviour change. The first level is behaviour change literacy level, and this is for anyone who is working in a health and care setting. So from the finance people that are making the decisions about finance, all the way through to people that are in non-patient client public-facing roles, but also including frontline services. And this is about creating a standardized understanding of what behavior change is, that there is an art and science behind this. So it's literally about making people literate in core concepts in behavior change. And there is an e-learning package that we've developed for this, one which is aimed at those that are leaders or managers, and one that is for individuals. So that's the behavior change literacy level. We then have the very brief intervention, which we're calling behavior change level 1. And this is for workforces that support service users with primarily an administrative need, where they may be looking for some signposting information or some very brief advice and support. And this is where we would position our Making Every Contact Count programs. Behaviour change level 2, which is brief and extended brief intervention, is where service users have a specific health and social care need. And then behaviour change level 3, which is a high intensity intervention, is where service users have a complex behavioural need. So the idea is that our workforces and us ourselves will have a certain need of a certain level of behaviour change skills need based on the service users that we support. And we've developed this to start off with an assessment. So if you're an individual, you can assess what level of behaviour change training you should be trained at. If you're responsible for a workforce or a team, you can also assess your team. And there are some short questions that you answer, which then provides you with results on what level of behaviour change training you or your workforce should be trained at. That then takes you on to the competencies, which is still in development, but the final in terms of it making this a bit more interactive, but the competencies can be downloaded here and you can access them, and that tells you what are the competencies that are needed for each of those levels and then what are the underpinning knowledge base. But what I wanted to focus on today really was the toolkits that we've kind of collated and coordinated. So the toolkits that sit behind each of these tiles aren't new tools. They are tools that are already out there. When we did our scoping for this tool, this framework, people were saying it's really difficult to navigate the resources and tools that are out there to support behavior change, and it'll be really great to have it all in one place so that it can be easily accessible. So that's what we've done. So we have a workforce toolkit and we have an individual level toolkit. The individual level toolkit is kind of, as it says, it's focused at individuals. So if I'm an individual who wants to support my own behavior change development, I can click into this tab and it will produce resources that can support me in learning about behaviour change. So we have the behaviour change literacy, and there are a whole number of other resources which include a combination of documents and frameworks to read, but also online learning. And if I'm interested in delivering behaviour change, there are tools here that can support me in developing my practice around behaviour change. For the workforce toolkit, we've categorized these under 3 areas. So understanding behavior change from a kind of a strategic perspective, planning and commissioning behavior change, and embedding behavior change. And what we've done is we've collated resources, frameworks, tools that can support each of those. So for the understanding behavior change in terms of what the strategic context, we have the Behavioural and Social Sciences Strategy, the NICE guidance, NHS long-term plan, person-centered framework, and so forth. And if you click into one of these, we've taken a behavioural science approach using the EAST framework to make these resources easily accessible. So we provide a very short synopsis of each of these resources in terms of what it is, how it can be used, and how it may be useful to you. And we've also included a time of how much time it may take you to read this document. You can also click here and post it onto social media, or email it to yourself, or email it to a colleague to come to later, or you can download the document. Just click out of that. And then you can, and the resource and the website will take you directly to the resource itself. And this is the same for all of the areas and the tools that we have here. So again, for planning and commissioning, there's a whole range of tools that we've identified that can be used to support you in planning and commissioning behaviour change. And it takes that same approach. You click into each of these and it gives you a brief synopsis, how much time it will take you to read, navigate this resource, and then you have the functionality of sharing it with people. So that is a very short kind of whistle stop of the behaviour change development framework. I'd really encourage you to have a look at this and share it with your networks. It is available freely across the UK and wider. We are currently in the stages of phase 2 update, which we're hoping to launch in the summer. And the URL is www.behaviourchange.hee.nhs.uk. Thank you. So I'm going to hand over to Deb now. Oh.
There we go. Thanks, Sam. You can go to the next slide if you like. So I'm going to talk to you about the Education and Training Directory for practitioners. I'm going to give you a bit of a background to the directory and why we decided to commission the directory in the first place. A bit of an overview of the project objectives in relation to that directory, the scoping report and the training directory itself, and then give you a bit of an idea of how we're planning to maintain that directory and the next steps. Okay, so from a background perspective, some of you may or may not be aware of the Open University course, which was the K311 around promoting public health. That was a course that we commissioned quite widely across HE, and I know it was commissioned wider than that to support practitioners in public health for the purposes of going on to do their registration with UK PHR. So we were really conscious that that was coming to an end, so it would no longer be available. So we had lots of things to consider, and one of which was, should we just create something similar? But what we had to think about was what was there already, what was available to practitioners, how do we collate that information rather than repeating what's already out there. We wanted to make it meaningful. So and also, were there any limitations? You know, were there any particular areas of knowledge for a practitioner where there were quite limited access to courses or education? We had to also think about our target audience. So we can say, yes, absolutely, it's for practitioners for registration purposes, but actually it's wider than that. It's about practitioners coming into public health and with potentially limited knowledge competencies and wanting to wanting to progress their careers in public health. And then we also wanted to think about those practitioners who were already registered, who may want to think about their CPD requirements to maintain their registration. So whatever we decided to do, we wanted to make sure that it ticked all those boxes. And then ultimately we had to think about funding the project and how we go about creating that directory. So what I would say is that we were really lucky. We did secure some funding for the directory from the National Health Education team, and we were able to commission Kate Lees, who's a public health consultant, but also a moderator with UK PHR, to carry out this piece of work. She was a great asset, so we can't take the credit for the directory in its entirety, because actually Kate did an awful lot of work in creating it, but actually her knowledge around the public health practitioner standards was essential in putting this directory together. Next slide, please, Em. I just want to flag, obviously Em's on the call, but there's also another colleague, Joanne McEwen from Wessex, who was involved in the commissioning of this piece of work. So it wasn't done just by me. So the project objectives were to scope the training and education available to practitioners, and that was really important, because we wanted to make sure that whatever we put in this directory, it did actually tick the knowledge requirements of the practitioner standards. So that was actually a must, but also thinking about the levels as well, the level of training required. So to produce that training directory as part of the objectives, we wanted to ensure that they were mapped against the standards, that the training and education met what the standards, which standards they met, categorizing the training by education, by qualification level, and also things like what were the costs for those training, for that particular piece of particular training, or whether it was online, face-to-face, etc. So that was really important to make sure that was included in that training directory. And then finally, as part of the scoping, what we wanted to make sure was that we were able to highlight any areas where there were limited access to education and training for any given standard. Next slide, please, Em. Thank you. So as I mentioned before, so for the scoping and training directory, obviously we needed a course name and a link, so that the directory delivers on that. Also the course provider, course details, again, face-to-face, online, any assessments that's required, etc. And then cost, or if there is a cost. And what I would say is the majority of the courses that are available through that directory, they're quite low cost or minimum cost or no cost at all. Then qualification level, any certification or accreditation, any quality assurance is highlighted, and also which standard it highlights. So it's all hyperlinked within the training directory, so that if you click on a standard, it will tell you what courses are available, and vice versa. You can click on the standard and it will tell you, click on the course and it will tell you which standard. So it's fairly interactive. Next slide, please, Em. So the directory itself, I put the link on there, so you've got access to that. So if you haven't had a look already, please do go and have a look at it. We've had some really fantastic feedback from lots of colleagues from all over, saying how much they valued the training directory, and it's a really good resource, for people that are starting out in their career in public health, those practitioners that are working towards registration, and those practitioners that are already registered. So please do have a look. We know it was only launched in January of this year, and we know that it's had a huge number of hits on the health education website. So so we know it's getting used, which brings me on quite nicely to the next couple of slides. So the scoping report, as I say, one of the objectives was to highlight any areas where there was limited training opportunities, and it highlighted 6 particular standards where there were particular limitations. So I'm not going to talk through each one individually, but what I would say is that 1.6, 1.7 and 8.3, when we looked at those, we decided that actually those could probably be addressed by practitioners within their organisations, whether that be through team building exercises, through in-house training by that particular organisation. But the three that I want to highlight specifically are 1.2, 2.6 and 7.6, and they are ethics, qualitative research and quality assurance. Now, from a Health Education England perspective, those are the areas that we'd probably focus our attentions on going forward, and think about how we can support maybe the creation of something to add to that training directory going forward. Next slide, please. So it links in quite nicely with the maintenance of the directory. So we are actually Health Education England as an organisation facilitate the National Practitioner Network, and we have obviously participants and colleagues from all over the country that dial into that network group. That group has agreed that we would support the review and maintenance of the directory going forward, because what we do want to make sure is that it is fit for purpose and that it's maintained, and the courses that you're linking on are going to still be there, but also being able to add any new courses that come up that may be useful to you as well. And secondly, that group will work collectively to think about how we can address some of those knowledge gaps that were highlighted in the scoping report, and things like public health ethics we're already looking at, and obviously we will then think about the quality assurance and the qualitative research elements as well that have been highlighted. I think that's it.
Thank you, Deb. So finally, the final slide from us before we go to have a couple of minutes for questions. So there are other resources that are available, but we just didn't have enough time to really kind of talk through these. But we've listed these here, and I'll just quickly highlight these. So the Population Wellbeing Portal is a collaboration. It is a portfolio. Is a portal that was produced in collaboration with Royal Society of Public Health, Faculty of Public Health, UKPHR, HEE, Public Health England, and a number of other organisations. And it pulls together all existing online e-learning that is available in relation to population health and well-being. And there's a catalogue there that you can search for under topics like obesity or mental health, and there are also links to resources, and that's hosted on the eLearning for Health website. You then have the NHS Apps Library, which I'm sure you're all aware of. Just to highlight that apps that go onto the NHS Apps Library go through a rigorous process to ensure that they are fit for purpose, and they include a whole range of apps, from kind of clinical service delivery, but all the way through to kind of well-being, public health related apps. The PHE Partnership Marketing Team, and I think there are similar marketing health promotion teams in the other nations as well. You just have to register with them, and they will send you information that you say that you're interested in, and this is campaign materials and resources that will come through to you to access and share within your networks. And then the government's All Our Health initiative, which includes presentations, posters, leaflets, templates, and videos and animations that can support you. Great. So that is the end of our presentation. I'm just going to look at the questions. So we've got a question from Melissa. Are there plans or opportunity to embed resources from across other UK nations? I'm assuming into the Behaviour Change Development Framework. Yes, there are resources already in the toolkits that are from the other UK nations. And what we're going to be doing as part of phase 2 is creating an opportunity for users to submit resources that they feel would be able to contribute. So creating a bit more of a community feel, and there'll be a process where they'll be able to click a button on the website and submit a URL and write a brief kind of synopsis of what that resource is and how they think it fits, and then we will kind of look at that, and then if it kind of fits, then we'll put that onto the toolkit. So we see the toolkit section being a kind of a growing and reviewing kind of aspect of that. Great. So, Deb, I don't know if you had any final remarks before we close.
No, just to say thank you for listening today, and please do go and have a look at both the resources and the links to the other resources that Em's highlighted at the end. I've just noticed that there is somebody on the call today. So is it Alina Mackenzie? You've just completed your public health registration from Hampshire. So congratulations for that, because I know it's no mean feat. So well done. Yeah, nothing else from me.
Brilliant, thank you. Thank you everyone for your time and attention, and hope you enjoy the rest of the morning. Thank you.